As we now move to the evening's award presentations, it is a distinct pleasure and honor for me to be able to welcome our first presenter to the podium. Ambassador Jim Hormel is one of the Shanti Project's most long-standing and supportive partners and friends. I am so pleased that he and his partner, Michael Nguyen, can join us again in person tonight, and I am so grateful to them for their roles in this year's annual benefit, as both are presenting sponsors and honorary co-chairs. To present tonight's first award, I'm going to ask all of you to please help me welcome the Honorable Jim Hormel.
Introduction, and a very warm thanks to the Shanti Project for its long and devoted service. You've already heard the word compassion, and I plan to use it again. But I would like to take a moment now to speak of an individual who represents compassion. It occurred to me that many people in this room were not in San Francisco at the beginning of the 80s. Many people in this room may not even have been born at that time. And perhaps I should reintroduce my partner, Michael. For those people, I wish to say that you have no idea what it was like. What it was like at a time when a revolution had taken place, which some people refer to as the sexual revolution. And suddenly, with no apparent warning, the community was hit by something that was unidentifiable, that did not have a name, but that was very clearly affecting a constituency here in San Francisco, a constituency of gay men who were falling ill, who were dying, who were showing symptoms of diseases that were never seen before in that constituency. And there was no one around to deal with it until Charlie Garfield stepped forward. Charlie had started this organization called Shanti back in the East Bay in the mid-70s, out of his position with the UCSF Cancer Institute, with the intention of supporting, giving compassionate support to people who were experiencing life-threatening illness. And the illness of that hour was cancer. But the moment that what came to be known as HIV/AIDS came on the scene, Charlie was there. And because of him, we're all here tonight. And because of him, organizations around the country and around the world have learned through his instruction what compassionate care really means. So Charlie, I honor you. Tonight it is my pleasant duty to present the 2010 Funding Leadership Award to the San Francisco Foundation, an outstanding leader in cutting-edge philanthropy and a vital partner to Shanti. The foundation has been instrumental in supporting those in need in the Bay Area for over 60 years. And Shanti is proud of its longtime support. The foundation's relationship with Shanti goes back more than 2 decades. It goes back to the earliest years of the HIV/AIDS pandemic, and with the help of the foundation, Shanti was able to provide compassionate care through direct services to San Franciscans at a time when HIV/AIDS was a little-known illness and many infected people were dying. Since then, the foundation has played an important role in strengthening many of Shanti's other projects, including its volunteer program, allowing Shanti not only to train greater numbers of volunteers, but also to train other organizations and their volunteers in the Shanti model of compassionate care. Most recently, the foundation has been one of the pioneering and most generous funders of the Lifeline's breast cancer program, which supports many of the most vulnerable San Franciscans with breast cancer. Originally planned in 2001 as a pilot program to serve 140 clients, this year, Lifelines will serve close to 500 clients. This is largely possible because of the continuing and increased funding from the foundation. For the incredible impact the San Francisco Foundation has made on Shanti's mission, over many years, and in a spirit of cooperation based on Shanti's integrity, which was proven through many efforts and grant applications to attract the foundation's support. And in recognition of the many years of civic leadership and creative philanthropy in the Bay Area, I am pleased to present the Shanti Project 2010 Funding Leadership Award to the San Francisco Foundation, and accepting on behalf of the foundation is its wonderful president, former head of the San Francisco Department of Health, and my good friend and counselor, Dr. Sandra Hernandez.
Thank you, Jim. Thank you very much for that introduction. And you know, as a foundation, we recognize that we really don't do anything except support the extraordinary work of the community. And it is your community foundation, and therefore it's quite appropriate the San Francisco Foundation has been a long-term supporter of Shanti. I wanted to share just 3 reflections because Eva, my partner of 18 years as of yesterday. Eva and I were talking as we came in today. You know, we're in the last decade, the first decade of this century. And both Eva and I lost a brother to HIV/AIDS very early in the epidemic. Neither of them really had the advantage of any HIV medication. I was a very young physician when I came to San Francisco. My brother was living in New York at the time, and he called me and said, I'm moving back home to Tucson to be with Mom and Dad during their retirement. And I knew why he was moving back. And he spent 16 months in an acute care hospital with no peer support. My mom and dad were there every day for 16 months, and for 16 months he was in an acute care hospital. And I was doing my residency here and going back and forth to Tucson and San Francisco General, where half of the service was infected with HIV disease. And it was such a stark contrast for me to be able to be in a community that took people home, kept them in their home, kept them in their neighborhoods, kept them in their houses, took care of their pets, did all the things that helped their life be as dignified as it could be as they dealt with HIV disease without any HIV medication. And so the remarks that we heard earlier about when there isn't a Shanti, I actually experienced. And so as a physician coming into the health department, I really appreciated organizations like Shanti because it's where I learned about how community creates community. And the San Francisco Foundation, its mission is about improving the quality of life in community with a particular emphasis on the most vulnerable. And of course, that's exactly what Shanti's mission is, as you heard earlier. And so it's really quite appropriate that the foundation, your community foundation, has supported Shanti over these many years. I'll say as a physician that I have many, many, many patients. And coming up the escalator tonight, I saw a photograph of another one of my patients. And so as a physician, I want to thank all the volunteers, all the staff, the boards of directors, the people who volunteer their time to oversee an organization like this for 36 years. The San Francisco Foundation is your community foundation. It's been our great honor to support your great work.